talk about what is a headache. A headache isn't a bruised brain or a broken skull. It's just a pain that comes from the nerves or the muscles in your head.
Headaches are common at any age. There are 3 basic types: tension, cluster, and migraine headaches. Tension headaches brought on by stress and emotional strain are the most common. Pain is usually felt on both sides of the head, at the temples or back of the head and neck. Less common are cluster headaches, which are marked by severe one-sided pain that comes back in episodes or clusters over weeks or months. They start in an area of the brain called the hypothalamus, which is more active during the headache. These debilitating headaches run in families. Migraine headaches also run in families. They are often confused with sinus headaches, but differ in the following ways. Migraines often start quickly, sometimes with visual disturbances called auras before the headache. The pain worsens rapidly and usually resolves within 72 hours. Migraines often occur more than once a month.
The symptoms of a headache are pain, which could be isolated, could be widespread across your head, or could be from one side to another. And the types of pain that you might experience would be maybe a sharp sensation or throbbing pain or a dull ache. And they could appear gradually or suddenly.
There is a wide range of different headaches, including cluster headaches, migraine headaches, ocular migraines, sinus headaches, and tension headaches.
If you have a headache, you want to get it treated, and here's how. If it's a muscle headache, that kind where there's a band around your head and it just feels like a tightness, the best thing for that is relaxation, heat, massage. There are certain prescription medications that relax muscles and they work like a dream. So you have to see your doctor for that. But generally exercise will help that, and massage is a wonderful thing. Finding something that relaxes you. Now migraine headaches is a whole other thing. These are the headaches where you get nausea, vomiting, light and sound bother you, and these can be very debilitating headaches. I tell my patients that the sooner you get treatment for a migraine headache, the sooner you can prevent it from growing into a full-blown migraine. I tell them to take a combination of 3 things over the counter. Get some either ibuprofen or naproxen, that's an anti-inflammatory, a dose of caffeine, like a cup of coffee or a glass of iced tea, and some acetaminophen, Tylenol. Do all those 3 at the early beginnings of the headache and maybe repeat that in about 4 hours. Sounds like a lot of medicine, but it's not. You do that and you'll prevent a lot of these migraines from growing into a day or 2 long headache episode.
Stretch your leg out and sit on your right foot. Sit on the arch of the foot. The other leg is stretched out. The right knee is at about a 45-degree angle. And then as you inhale, you stretch up, lengthen your spine, and as you exhale, come down and bring your forehead down to your knee. To come out of the asana, inhale, you stretch your hands up, exhale, and down. The Halasana, sit with your legs straight, stretch straight, your spine relaxed, and then slowly lie down. And from here, lift yourself up into Sarvangasana first, and then from here, move to the Halasana. Slowly lowering your legs. Once your toes touch the floor, curl your toes, release your back support, interlock your fingers on the mat. Feel this complete stretch. Stay for as long as you're comfortable, and to come out of the posture, you can either go back into Sarvangasana and come down, or gently from here roll down vertebra by vertebra, keeping your knees strong, your abs strong, and gently come down. Paschimottanasana, the forward bend. For this, sit up nice and straight, and as you inhale, stretch your hands up, lengthen your spine, make yourself taller, almost trying to create a space in your spinal cord. And as you exhale, keep your chin up and bend forward. Extend your spine, hold on. If you can't hold your feet, just hold your legs wherever you can reach, and take a deep breath in, and as you exhale, drop your forehead down. Once again, stay here for 5 deep breaths, or as long as you're comfortable holding, and then we're going to come out of the posture. Inhale, lengthen your spine, stretch your hands up, exhale, and down.
One, low-fat milk. One of the biggest headache triggers is dehydration. And not only is milk a hydrating liquid, but it's also full of important minerals like calcium and potassium that offset the effects of high sodium diets. 2. Cantaloupe. Because fruit like cantaloupe are high in both water and potassium, it can counterbalance dehydration too. 3. Cherries. Along with being a hydrating fruit, cherries contain specific compounds that convert to nitric oxide in the blood, which can protect against headaches. 4. Potatoes. Like melons, potatoes are chock full of potassium, which can help treat headaches if you're dehydrated. 5. Fatty fish. Foods rich in B vitamins like B6, B12, and folic acid like salmon and tuna have been linked to helping to hold off headaches. 6. Navy beans. 1 cup of navy beans has more than 25% of your daily value of magnesium, which is an ache soother thanks to its role in muscle contraction, including those pesky blood vessels that cause headaches.